In the heart of the Arabian Peninsula lies Oman, a land of breathtaking deserts and mountains. However, this country has transformed dramatically over the last few decades. Unfortunately, with this rapid development and urbanization has come a big challenge.
Non-communicable diseases now make up 7 of the world's top 10 causes of death.
Well, a new study is shining a spotlight on how the deadly combination is on the rise.
25.4% of elementary students are overweight.
41 مليون شخص يموتون سنويا.
Non-communicable diseases, or NCDs, also known as chronic diseases, are currently the #1 cause of disability and mortality worldwide. Some examples of NCDs are heart disease, stroke, cancer, and diabetes. According to the WHO, NCDs cause 41 million deaths each year, equivalent to 74% of all deaths globally. Non-communicable diseases are recognized as a significant global health challenge. The third Sustainable Development Goal, good health and well-being, includes a specific target to reduce premature deaths from NCDs by 1/3 by 2030. Just like other developed countries, NCDs have been on a rise in Oman. In this documentary, we chose to focus on the 3 most prevalent conditions observed at the Family Medicine Clinic in Oman: cardiovascular diseases, including dyslipidemia and high blood pressure, obesity, and diabetes. To learn more about the rise of these 3 non-communicable diseases in Oman, we interviewed 3 doctors at Sultan Qaboos University Hospital in Muscat.
So, I am Dr. Chandra Kumar Lohana, and I'm working here as a specialist family medicine from last 10 years. And I'm originally from Pakistan. I graduated in 2001.
Yeah, Adil Hashim Al-Kindi. I'm a senior consultant in cardiovascular surgery, and I'm the head of the division at Sultan Qaboos University Hospital.
I'm Dr. Yaqub Isaidi, occupational and family medicine consultant at Sultan Qaboos University Hospital at UMC, which is University Medical City here in Oman, Muscat.
There are several causes to the rise of NCDs. Physical inactivity, unhealthy eating habits, and tobacco use are some of the well-known causes of chronic illnesses. We asked the experts to explain more about the specific causes in Oman.
I think one of the main reasons why we see such an increase in NCDs in Oman, I would say in the last few years, is the significant change in lifestyle over the last 50 years. The Omani population lifestyle has changed into a more sedentary lifestyle. Of course, this is a direct effect of increase in the standard of living, and the transformation of jobs and daily activities to more sedentary lifestyle. Also, the increase in the standard of living and the income has produced an abundance of food, and the two together has given a rise to obesity and also to the other non-communicable diseases like diabetes. The two together has significantly contributed to the increase in what we see now are the cardiovascular NCDs. This is the main reason, but also we have other reasons. I think secondary reasons is we are still a kind of a tribal system where intermarriages are very high, and we do see hereditary causes for hyperlipidemia, diabetes, and so on. This is another reason, and the final, probably less, the reason is that we know that certain diseases like diabetes and so on do prevalent more in certain communities.
Traditionally, Oman is a very culture where food is celebrated. We say that's in overall GCC and especially Oman also the culture is of social gatherings, lot of social gatherings, And in social gathering, food is the main part. And you know, when social gathering, there's no portion size in Oman. So they usually share same big plates and they share combined eat from them. So there is no portion size. And also culturally, they visit a lot, especially celebrations are there. In one celebration day, they go each other's house and they eat there. So these things, and especially Oman is popular for traditional, their Omani halwa. So it is also served in every home. And dates they eat a lot, even diabetes, but they think it's healthy, so they are off limit in that what they want to eat.
In 2021, NCDs were responsible for 52% of the deaths in Oman. Also, in 2019, a 30-year-old person had a 21% chance of dying before their 70th birthday from NCDs. The world average is 18%. These increasing numbers lead to high costs in health expenditures, absenteeism, and loss of years of productive life. When zooming in on Oman, a cross-sectional study showed that NCDs cause about 185 per 100,000 deaths in Oman. The experts will tell us more about the impact of the increasing numbers of NCDs in Oman.
I've been in this hospital for 10 years now, and I do see increase in the prevalence of these diseases, and also, the type of patients that we see. We do see younger people who require surgery because of NCDs rather than from natural aging issues.
Because the number is rising, and we know, I think first thing we feel time restraint also, because we cannot counsel every patient. It needs a lot of time to manage a patient with chronic disease. They need explanation, and in terms of dietary, in terms of if we start insulin, then we need to also communicate things. And we don't have enough resources. Every center don't have diabetic nurse, because this is the one diabetic nurse or dietitian. So that's why these are the challenges. Because for chronic disease, it needs a multidisciplinary approach, and we don't have expertise in every center, in every health center. Or like here in even for example this setup, we don't have our own dietitian here. So we feel these challenges, we need more expertise so that we can means multidisciplinary approach. We need a doctor, dietitian, food podiatrist. So we don't have these facilities everywhere. So these challenges are there.
Over recent years, the rise of NCDs have had a profound impact on the Omani society, revealing stark differences between the older and younger generations, or between men and women. The pattern of NCDs in Oman is uniquely shaped by the country's own culture, norms, and values. We further explored how Omani society influences the rise of NCDs, and conversely, how the increasing prevalence of these diseases is affecting the social fabric of Oman.
We have, I will call it 3 generations: the younger generation that we have, and the middle generation, and the old generations. And this is not the scientific way of dividing it, but why I'm saying that, because the Renaissance in Oman, it was in 1970, where people at that period of time, they are relying on their physical demand and physical activity. So most of the people at that time, they were slim. And then the generation where the era of the modernization and urbanization came, and the junk food is there, and a lot of habits came to the culture. This is where we notice that NCD is increasing more and more. Now, the difference between the two, the younger generation, they are looking for the body shape, looking for the effect of the social media, looking for the peer effect. So this is the factors that might contribute. This younger generation will practice healthier lifestyle comparing to older generation. The equalization between men and women is here in Oman is more. We notice that the obesity itself is more in women, and that might be because of their lifestyle and spending most of the time at their home with their kids. And even if they are going to the work, they will go from work to the house. So the time for the activity, it might be really very strict with them. comparing to women who will, after working hours, they might go and practice in the gym or practice in the open areas. So the gender difference is there, I would say. The ability to do the exercise, and this is a challenge. Although the Oman is like equal between the genders there, and they can practice the exercise in the gym. They can practice in the open places. But again, we notice that it's more the fitness and the gym or the lifestyle in men more than the women. Although the shape of or the image of the shape is more toward the females and women's. Well, Oman is a very conservative community and culture here. So we have protective factors, I will call it, from these habits. For smoking, the Omani population, I believe we have around 13% of the population is smoker, and most of them are male. And why is that? The religious itself. So Islamic religion, it's not allowing anything harming the body. So this is something which is protective factor for us. And the culture itself, it is like a stigma. If somebody is smoking, there will be like a stigma where people, they don't want to smoke in front of others, so they will avoid it. And it is applied same for alcohol. Islamic culture, they are not allowing the alcohol drinking. The other things, the culture itself, they are not allowing, and they are not welcoming the locals who is drinking alcohol. So this is something which is protecting our local people from doing these type of habits and behavior.
My younger diabetic patient, I see them in more, they are going to gym compared to older things. But sometimes, like I see, having said that remind me of one patient also. Like he was a newly 17 years old. So he was diagnosed with diabetes and his hemoglobin A1C was 13. And I advised him about to start the metformin. But he said no, refused, because his father was diabetic. And he said, if I will take medicine, then I will be going more on medicine in this pathway. He said, no, I will go for a lifestyle. And he was refusing, though 13 it was high, even they say start insulin, but he was even refusing medicine. Anyway, so I was expecting what will happen. So, but when he came back, what do you expect is hemoglobin? What is his hemoglobin A1C? It was 6.
Wow.
So, because I think his dietary patterns, he was not knowing diabetes, he was having a lot of fizzy drinks, Pepsi, as you told, now people high calorie foods. He was going to the fast food restaurants, so he stopped all those things. He was doing 1 hour vigorous exercise, more physical activity. So he changed. So there are some cases in young, especially these cases. In older generation, we don't find these kind of things.
The number of NCDs in Oman is unfortunately following international trends. To help reduce these numbers, the Ministry of Health developed the Oman Vision 2040. This vision focuses on the national priorities such as healthcare, economic leadership, well-being, social protection, and education. In the health sector, the goals are to develop technology-driven medical systems and services, but also to emphasize the importance of a healthy society free of health risks, where health is the responsibility of all, as to prevent is better than to cure.
NCD screening, normally they screen, as I told you before, above 40, now they make it less than 35 years. They screen for diabetes, they screen for hypertension, they screen for lipids, they screen for thyroid as well. So these are the common disease here. So they screen for it at age 35 in this.
In terms of technology, it's like it used to be like we have non-invasive methods of diagnosing, and then we have to send them for coronary angiogram, which is invasive. Now we have cardiac CT in the middle, and there are other technologies that help in diagnosis simply and without any invasive. So the more of these technologies that can detect whole diseases simply as an outpatient or in the clinic will certainly help in picking patients before they are at an advanced stage.
Lastly, we asked our experts where they see Oman in regards to NCDs 10 years in the future. Is there any light at the end of the tunnel?
I have like very the perspective of the health in Oman is very promising in terms of the NCDs, like the prevention and the treatment both. So for prevention, I believe the awareness is there more and more, and people start practicing this. In terms of the treatment, again, there is a lot of work is going on for the NCDs to treat these NCDs. So this is something which is promising in terms of NCD overall.
I think 10 years, Oman has, I think, in their guidelines, and they have some targets like whatever achievable in terms of where they see, like in terms of awareness, in terms of screening, in terms of prevention. And I think mostly they are achieving targets whatever they have planned. But I think still, as we discussed, still means quite a lot of ground need to be covered. I think significant, we see rising number of, on the one side we see rising number of the non-communicable diseases, on the other side government will be trying best, so we don't know where it will go. So because on the one side government is trying best to increase the number of personal health resources, on the other side it's still increasing. So I think if prevention is taking more takeover, then things will be balanced. Maybe we see, but we hope whatever the government are trying in a multi-level, like from, as we told, from food industry to modifiable risk factors, I hope it will be a significant improvement in the forefront.
Big geographical country with a small population that's spread everywhere. I think one of the main things that we need is rapid transport system, because it's very difficult to have cardiac centers everywhere and have good outcomes, because the volume will be very small. First of all, the cost of establishing these will be high. So assuming that we do have the money to establish them, these centers will never be able to do complex things or have good results because the volume is small. So I think, in order to overcome this is to have a good transport system for the patients, and that is dedicated like air transport or so on of that sort, that can actually transport the patient from the extreme areas of Oman to the big centers in the capital or the south. I think that is something that will be a big game changer in this aspect. There's more awareness now, unfortunately. I mean, I see a lot of people, understand the risk of NCDs and they take their precautions. So they exercise, they eat less, they look into refined, processed foods and so on, they avoid them. And there's a great awareness of this thing. I think more awareness would help. And I don't think it's gonna grow in terms of percentage in population, but it certainly will grow because the population, as I said earlier, is aging. And this is a natural thing. If you live long enough, you're gonna have heart problems. So I think people are more educated about the risks. But at the same time, we have to continue the education and also be prepared for the aging population. Yeah.
Throughout this documentary, we have delved into the growing challenge of NCDs. Through expert opinions, we have learned about the causes and effects of NCDs, the unique aspects of the Omani society in relation to these diseases, prevention, and the future of these diseases in Oman. In the future, we would like to explore the effects of NCDs on the healthcare system in the rural areas of Oman. To address this NCD crisis, we propose some steps. Number 1. Promoting health lifestyle with national campaigns and regulations on unhealthy food options. A healthy diet coupled with no smoking and a physically active lifestyle have been associated with a reduced risk of NCDs. Number 2. Improving accessibility to dietitians and lifestyle coaches. Number 3. Further strengthening the preventive care by using technology. Boosting digital health has proven to prevent deaths from NCDs. The key takeaway from this documentary is that tackling NCDs requires a collective effort. The solutions are simple, but implementing them requires commitment from the government in terms of policies, healthcare professionals, and the community. As Oman continues to battle with its crisis, let this documentary inspire action, not just in Oman, but all countries striving for a healthier future.